This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Mike Sedita.
Hello out there. Welcome to episode 167 of the Good Neighbor Podcast. I am your host, Mike Sedita. Today we are joined by the owner, head dentist in charge, Dr. Sheetal of Bliss Dental Lounge. How are you doing today, Doc?
I'm doing fantastic. How about you?
I'm doing great. Your location is that considered Lutz or Land O'Lakes?
So it is actually Lutz, but we sit right at the peak of Lutz, Land O'Lakes, and Odessa.
Yeah, it's right in that little triangle where they all come together there, right off 54. I've been to your facility before for a huge Chamber of Commerce ribbon cutting years ago. It's a beautiful location. You're right there. That whole area has blown up quite a bit in over the past couple of years, and every time I drive out your way, it's like something new that I didn't see before.
Oh, absolutely. Like, this is my 5th year here, and it's fantastic. Like every week there is something new, and the influx of people we've had is amazing.
That's great.
And it's from all over the country. So it's fantastic to see all new people moving in. Yeah.
So just so you know a little bit about what the Good Neighbor Podcast is, back in 2020 during COVID, when you couldn't put your fingers in anybody's mouth and move their teeth around, we all had to be socially distant, and it was created as a way for business owners like you to let people in the community know what you had going on. And 4 years later, now the Good Neighbor Podcast is a national brand. We have podcasts in Denver, Atlanta, Virginia, Philadelphia, all over the U.S. I'm lucky enough to be the person here in Tampa. So tell us a little bit about Bliss Dental Lounge.
Okay, so Bliss Dental Lounge, like I said, this is the 5th year here. I've been in practice for 25 years. We're a family and cosmetic dentistry. We focus a lot on cosmetics. We do Invisalign. We offer services from crowns, implants, dentures, partials. We've started offering a lot of Botox too for patients. I see a lot of patients with TMJ pain and, people who can't open their mouth. So we offer a lot of Botox for those patients as well. We've been here in this community. I think, like I said, all the new influx that we've had and the patients we've had here, it's just wonderful to meet all of them. The practice is a very state-of-the-art, latest technology. For me, it was very important when I had this office in conception that patient comfort was the number one priority for me, right? So everything that I designed, I personally designed the whole office. It was very important that each corner of the office was catering to patient comfort, how patient got the best experience when they came into a dental practice. So that was the whole vision to start Bliss Dental Lounge.
So first, let me apologize. I said Bliss Dental Lounge. Bliss Dental Lounge. It is like a lounge in there. I've been in there.
Thank you.
The first question I have to ask is, you've been doing this 25 years. How long have you actually been in that location right off of 54 in quote unquote Lutz, that triangle?
This is the 5th year.
5th year. And one of the things that always fascinates me, I'll go back for a second. With all the services that you offer, are you I know you have staff, but are you a one-woman shop, or do you have people that actually administer the Botox for people that are having TMJ? Do you do the cosmetic stuff? Is that all you, or do you have somebody else in there that works with you?
No, so I do all these procedures. I've invested a lot of my 25 years in training and doing advanced education. And I feel like the patients who come to the office, they trust me to do all these procedures. So I do a lot of all procedures. But if there's a complicated procedure that I feel that the patient might be best taken care of by a specialist, we work in close association with a couple specialists around in the area who we refer to.
So the thing that I was going to say a second ago is it really amazes me the technological advances in the dental field. Like, I remember going to the dentist, just the stuff that everybody hates, like the grinding and the smell and like the sharp pain and all that stuff. Right. That's kind of been mitigated just in the tools that you use. Right. I remember, when I was a kid, having to constantly rinse and spit and do all that stuff sitting in a dentist chair. And that's kind of mitigated with like tubing and suction and all that stuff. X-rays are better. All this stuff is better. So you've invested, quite a bit of time and money into building a facility that takes away a lot of the stigma, that comes with going to the dentist.
Absolutely, absolutely. So, like you mentioned, right? X-rays was one thing that most patients, when they walk in, they're like, I don't like the X-ray. So digital technology is amazing because it's so much more quicker, and also the radiation is a lot lower. So which was very high radiation with the old kind of technology. The newest has cut that down to like 5% of what it used to be.
Wow.
And then we have digital scanners, so it'll really not making impressions. Patients hate the goop going in their mouth. You always hear people saying goop. So that's one thing. That's where the digital technology helps the patient. And also we see things much better than what we did. We have magnifiers, we have loops that we use, we have a CBCT machine that's like a CT scan of the head. It gives us in-depth visualization of everything that's going in the patient's mouth. It just lets us diagnose and treatment plan patients better than we could ever. Like dentistry, like any other branch in medicine, is at its best in terms of technology. And I've done everything in my capacity to have the best technology in the office.
One of the things that really fascinated me, at one point I did Invisalign. I probably should have kept up with it better than I did, but the technology of the scanner to be able to run through my teeth in my mouth and create an immediate scan of my jawline, my teeth, the impressions, all that stuff. That was absolutely wild just to watch, because I'm literally watching on the monitor as you're running the scanner over my mouth, and my teeth are just appearing, are appearing on the screen. From your standpoint, doing this 25 years and seeing the changes, the first question is, does it make your life a lot easier? I'm assuming it does, but is there any one particular thing where it's just way easier? And two, how much of the training and transition, like the old expression, you can't teach an old dog new tricks. I'm not calling you an old dog, but I'm saying you did it a certain way when you learned it, and now it's a whole new, it's more technical. Does it take a lot of time to get into that?
So to answer your question, like the skills still stay the same, right? You just have to update. It's like learning anything that new out there, whether it's dentistry or not. You have to stay updated with the technology. And that's what I said. I invest a lot of time in continuing education. So the newer technology just makes it easy. It's like riding a bike, you knew how to ride a bike. Now you have an electric bike that you're riding. So it just makes your experience better. And at the end of the day, it lets you do your job much better than what you used to.
So you did talk about the influx of people coming in there. I work in Bexley, I work in Ballantrae, I work in Starkey Ranch out in that area. And every time I go out that way, it's like another new neighborhood is popping up. And you said you're seeing people from all over. Like, are you seeing people from like the Northeast that are moving here and they're looking for a new dentist and you're getting them kind of started? Is that the type of folks you're seeing?
Right. So since I've been here for 5 years, so I've kind of started while the new influx happens. So we see patients from all over the country, and 80% of my patients are people who have just moved in the area, like 6 months ago, a year ago. So that's where it is. So a lot of patients are coming in, they're looking to get established, find their dentist, find their doctor, find their salon. So they're all getting in, looking for all these services.
Well, and I could tell you, I mean, listen, the competition is tough as a dentist. I mean, it seems like there's a new dentist office opening every quarter mile, but then it always seems like everybody is so busy. Like there's just so many people. Like you call an office and there's a wait and all that stuff. So there's the medical side of it, of you being a professional in that medical side of it. But from the business side of it, like when you were a young lady growing up, did you always want to be a dentist? I mean, did you want to do something? Did you want to be an opera singer or something different that you just decided that dentistry was the fallback, or did you always want to be a dentist as a child?
So when I was like early in my college, I knew I wanted to do something that I could help people with and something in medicine. And I think dentistry was a perfect life-work balance for me. Also, growing up, I haven't had the best of dental memories, right? My experiences were not great. So that was another reason I'm like, if I do this, how can I make things better for people, right? So that was one big push that helped me get into dentistry. And it just happened where I fell in. I loved everything I did. And I think it was a perfect decision.
So I can tell you, I've had a horror story at a dentist in Atlanta. I won't give the name because I'm just not going to do that. But when I lived in Atlanta, I went to the dentist and I just got chastised. I mean, it's like almost like, Emma, I would ask you this. I mean, does it come with, when you're in dental school, did they teach you guys how to yell at patients for not flossing? Is that like one of the skills? Is there a whole class on telling the patient you need to floss more and doing it very firmly? Because this dentist had that skill down so much so that I got so stressed out in the chair that I got shingles. Like shingles occur from being in a high stressful position. I've worked with billions of dollars in a financial firm, transferring money and high pressure, fast, never had a stressful situation that caused me to break out from shingles until I sat in this dentist chair and had shingles on the whole side of my body.
Well, I'm so sorry you even went through that. I don't think anybody should have a dental experience right now. There's absolute no reason for it to be like that. You know, your dental experience, again, okay, let's face it, we're not on people's go-to list, right? People are not.
Right. You said it, I didn't say it. You're right. Oh, it is. It's a tough sell sometimes for people.
Right. So, I mean, the least we can do is, we provide compassion at the office for patients. It's important that I'm building a lasting relation. It's not a one-time deal. Right. I don't want patients to come here and then go back and never come back. I want patients to bring their family in, and that's what we do. Like patients, a big part of my practice is patients send their family and friends over because I think, I say I think because I have a fantastic team of girls that work with me, and everyone is passionate about what they do. They all go above and beyond. And that's why I think patients like what we do, and they want to send their friends over. They want to send their neighbors over. So I think that's the whole key. And that's very important, right? When you walk out of here, if a patient says, I didn't mind being here today, I think that's a win. Nobody ever says, I had a great time. But if they say, I didn't mind being here today and I look forward to seeing you guys again, that's a win for me.
The only people who leave saying they have a great time is the people that you give extra laughing gas to. Those people have a fantastic time. So the reason the reason I relived that entire horrible story is one of the questions that I have is, sometimes in dentistry, I mean, at least it was like this for a little while. I don't know how it is right now, but offices that got away from providing gas and providing those comforting things.
Right.
But that's kind of taken a turn. Do you guys, like, I know when I went to the new dentist that I went to in Atlanta, I got dark sunglasses so I didn't have to see bright lights. They would give me gas if I wanted gas just to take the edge off of the grinding. The lights were always dimmed. It was like mellow music. Is that all the things that you guys do?
Right. So you've been to my office, right? We have big screen televisions that's always playing like a good soothing music, right? Patients always ask us, like, where is this music coming from? But they love it so much. We have massager chairs, we have neck pillows, we have sunglasses for the patient. We offer sedation. So we have different sedation options that we give patients that can be done. But I think the biggest key is the trust, right? So if my first appointment or first meeting with any patient, my biggest icebreaker, I call, is gaining that patient trust. I think once the trust factor is there, the patients trust you, and that takes a lot of anxiety away. I think that's the key, which is overlooked significantly. I think just being gentle, your approach, your compassion, and like needles. Let's talk about needles. Patients hate needles, but then we use topical numbing gel, which works so wonderfully. I have at least 8 out of 10 people say, I did not feel the stick. Right. From there, it's smooth sailing. So once you get to that point, then it's easy.
So one of the big things is, like, when I was a kid growing up, I mean, you walked in, I don't know, maybe I misremember it, but it was like I saw the dentist immediately. Nowadays, though, the process, and again, the process at your lounge is mainly the first person I'm seeing is the hygienist who's going in and doing the x-rays, kind of getting a little bit of history and going through the process with me. And then you're kind of just not just checking in. I don't want to downplay what you're doing, but I've been to places where there's 6 rooms full of hygienists and they have their headsets on and they're going, Dr. Sheetal, I need you in here right now. And you walk from room to room to room. How many hygienists do you currently have? How many patients are you generally seeing ballpark a day?
Okay, so I have a full-time hygienist. We're looking to add a second one because we just have a lot of patients that are kind of need to schedule a couple of weeks out. But again, my goal is we're not a volume-based practice, right? We value patients' time. So if a patient expects to be at the office at a certain time, we never want them to wait. So we make sure that the patient has enough time so we can review all of the procedure with them. I have 2 other assistants which help with that process. So between the hygienist and the 2 assistants, we make sure that the patients are here. We do all the necessary steps. We take the x-rays, we do a history on them, and then that way we can educate them as well about if they're having concerns. It's never like, okay, you come in, you tell me this is my concern, and we slap them a treatment plan on the board and give it to them. It's always about educating. I want patients to know what we are doing and why we're doing it. So we take a lot of pictures, we blow it up on the computer screen so patients actually see what we see. So that way they're not only just getting the treatment done, they're actually getting educated about dental problems and how they can fix them or how they can prevent them. So all of these things, yeah.
I think for me, my whole life, I've always had relatively straight teeth. It's always the gum issue because I floss. I mean, I have the pick things, I have a water pick, I have all this stuff. It just never seems to be enough to where I don't ever go and I'm sure a lot of your patients, I mean, if they're like me, go into that dentist the day, but the morning of the dentist, I brush my teeth extra well that day because I think it's going to help somehow. Or extra floss, but I do floss regularly. The biggest issue for me is always gums. Is always the gum kind of receding. Is that probably I mean, I'm sure you have people, you see it all. I'm sure you've seen it all. But gum seems to be a bigger problem than teeth. I guess as you get older, maybe the teeth are starting to get worse. But is that kind of the biggest thing, doing gum recession type stuff that's going on with people?
Yes, gum recession is, so 60% of the population, Americans, they do suffer from periodontal disease, right? That's where the gum recession comes from. A lot of time, yes, it is environmental factors, like people are not taking care of their teeth, but someone like you, you're doing everything to keep your home care good. It's genetics. Genetics play a very big role. And that's why it's important that you kind of go in regularly. Some patients can be managed with just, coming in 3-4 months, but a small group of people do need some grafting. So if grafting is needed, definitely that's something we work with a periodontist in the community with, and they offer those services. And if a grafting is needed, I do recommend patients go get that grafting done.
So we've talked a lot about your business and you personally. When you're not at the lounge, at the practice, working with your clients, what do you like to do for fun? I know, I think I met your husband at the facility. And you guys have kids, right? You have one.
I have one son. Yeah, I have one son.
So, and he's almost a teenager, or he's preteen right now. Do you guys do a lot of stuff around his activities, or do you guys actually get to do stuff for fun?
So my husband is a physician, and we both have busy schedules. So any time that we have outside the office, it's family time. We love traveling, right? So we believe life is all about experiences. So traveling gives you that opportunity. So I love traveling. I love cooking. So a lot of my time is invested into learning about new recipes out there, new cuisine. My son loves food, so that's another big motivator for me to learn cooking, find new restaurants. So we love to do that.
All right, so we're going to stop right there for a second. I have 2 questions I always love to learn from people. Is number 1, from the travel side of it, what's the last trip you guys took, and where was it, and how great was it?
So the last trip that we took was last year. We did go to London because my son always wanted to go to London. So we just took a break for a couple days and we spent time in London. I think it was amazing. We explored countryside, which we had never seen. You never get to see this on TV. So
Right.
we just explored a lot of countryside, tried local food.
What time of year did you go? Was it? I mean, it's London, so it was probably raining no matter what time of year you went. But what was it? Was the weather nice, or was it kind of gloomy at the time when you were there?
We had a couple of different seasons throughout the time we spent there. There was summer, there was winter, and then there was a rain.
Awesome! You got to experience a whole year's
Yes,
worth of
we
weather
did.
in London in
Right.
1 week.
But I guess that's what London is, right? So that's what history
Right.
says. So yeah, but we explored a lot of countryside, which was amazing.
And then the other question I always like to ask is, so you said your son loves to eat, he loves cuisine. What is the last recipe that you pulled? Where did you pull it from? And you made it, and how did it, like, what was it and how did it come? Did everybody love it, or was your son kind of like, I don't know, Mom, maybe we try something different?
So I cook Indian food all the time, right? But my son really loves sushi. So the last thing I was like, look, I'm like, why not try making this at home? And we decided to try that, and it was a disaster. So at the end of it, I'm like, you know what? We'll just stick to the restaurants. But
we'll
no,
go to
I'm
takeout.
not.
Yeah, we'll go to takeout.
Right. But
That's great. That's great.
My son is awesome. He's like, no, mommy, it wasn't too bad. Maybe we should try it differently. He's a sweetheart. So I think I'm going to give it another try. I'm not someone who would give up so easy. So I'm going to try sushi one more time.
It's a difficult one, though. It's a difficult one to make because you got so many components to it besides the fish side of it that it's raw.
Right.
And then the way you create the rolls and the rice and get it all to stick together the right way. I mean, that's a complicated one for sure.
Yes.
What part? I mean, I know your practice is in Lutz, but do you guys live generally in that area? Is your husband, is he affiliated with a hospital or does he have a private practice?
So he has his private practice. He's also affiliated with the hospital, and we both practice in the Lutz area. I don't live too far from here, so it's about 20 miles for me.
So is there a go-to restaurant? I mean, besides a sushi restaurant, we'll leave that out because we already talked about sushi. But around where you guys live, is there a restaurant when you're home that your husband's like, yeah, we're going out tonight, this is where we're going, or your son has to go to it?
So it's not really where I live. I think right around here. I'm not sure if you know about the place. It's called Bangkok Sushi. It's a Thai place.
I'm familiar with it, but I have never been.
It's right. It's fantastic. It's our go-to place at home and go-to place at office. Whenever my team, we're in a mood to go treat the team to a good lunch, that's where we go.
Okay, so it's Bangkok Sushi, but you said it's Thai food. So can I get like drunken noodles there and all that stuff? They have all those dishes?
I think they do Thai and Japanese. So I think you have a pretty good range of.
That's good.
Yeah, and they're pretty good.
When I lived in Wesley Chapel, there was a great place right by my house that I would go to, and it was nice. I could order it. By the time I ordered it, left my house to get it, it was perfect timing. It was a great, easy round trip. I'm lazy, but I can't justify spending money on like DoorDash and stuff like that. I generally stick close to home and just pick it up. So as we start to get towards the end of this, we found out how much your son loves his mom by complimenting her bad sushi. We found out a little bit about you guys getting out and traveling. We've learned a lot about your practice. But what would be the one thing, if someone's listening to this and they're in the Lutz area, that they need to come see you over all the competition that's out there? What's the differentiator?
Right. So we're a family-based practice. I'm a private practice. We're not one of those chain practices. It's, for me, the biggest thing is the patients come first at the office. So if they're looking for a dentist or a family practice, that they come first, they should give us a call. I would like patients to know that we do accept most PPO insurances, all the major PPO insurances out there. We do take Medicare. I have a lot of phone calls every day that patients say, we don't have insurance. Are we still able to come see you? So for those patients, we do have an in-office membership plan, which is offers them a lot of savings. We have flexible finance options. Like I said, we never double book. So patients, we value their time. We always see them first, and their comfort and a great experience is what's most important for me and my team.
So, folks, if you're in the Lutz area, that Land O'Lakes, Odessa, right in that area along 54, if you know where the Aldi is, the office is right behind where the Aldi location is, right on 54, across from Dairy Queen and Dunkin' Donuts. There's a whole bunch of stuff being built right there before you get to, if you're going west on 54, before you get to the Suncoast Parkway there. Dr. Sheetal is the owner. She's the dentist. She's the head woman in charge. Bliss Dental Lounge. You can call them 813-995-6178. They will give you the personal care and attention that you deserve in what can be a very scary situation for a lot of people. Let her take the scary out of dental for you. Dr. Sheetal, thank you for being a good neighbor. Thank you for being on the Good Neighbor podcast with us today.
Thank you for having me. I think what you're doing is fantastic. Thank you.
Thank you so much, Doc. I'll talk to you soon.
Okay.
Thanks for listening to the Good Neighbor Podcast Passcode. To nominate your favorite local businesses to be featured on the show, go to gnppasco.com. That's gnppasco.com, or call 813-922-3610.